Middle, you will see you are live. The moment. Oh, shit.
Good morning, all. Welcome to the second edition of the Hindu's Health Webinar Series. Today, we will be discussing heart health and specifically the growing concern of sudden cardiac deaths among young individuals. Today, we have two experts, Dr. Kannan and Dr. Priya Chockalingam, who will focus on risk factors, lifestyle influences, early warning signs, and preventive measures. The session will also highlight current medical approaches and awareness strategies to reduce incidence and improve outcomes. Let me introduce the first speaker. Dr. Kannan is presently the Director, Institute of Cardiology, Madras Medical College, and the Rajiv Gandhi Government General Hospital. He's a distinguished interventional cardiologist with over 25 years of experience in clinical practice, academic leadership, and advanced cardiac care. Dr. Kannan completed his MBBS from the University of Madras and pursued his DM in cardiology from the Tamil Nadu Dr. MGR Medical University. Throughout his career, Dr. Kannan has held esteemed academic positions, most notably serving as the professor and head of the Department of Cardiology at Stanley Medical College, where he mentored a generation of cardiologists and led several institutional advancements in cardiovascular care. Dr. Kannan is renowned for his expertise in complex interventional procedures, including coronary angioplasty, device closures, pacemaker and ICD implantation, and peripheral interventions. He is also a passionate advocate for preventive cardiology and heart failure management. Over to you, Dr. Kannan. We'll get your slides right up. Dr. Kannan, can you unmute yourself?
Good morning, and to Geetha, Zubeda, the entire the team of Hindu, and a very good morning all the people online. It's indeed a great opportunity, and it's a very compelling topic when we see patients. Suddenly, we see news of people dying suddenly on football fields, in gyms, and then the panic sets in. Why? So it's really we are looking at just how to go about this and why these things are occurring in real life. So we'll go to the presentation and next. Can I have the next slide? Oh, yeah. See, whenever we discuss sudden cardiac death, it means that the death when less than 1 hour from symptom onset. So that gives us very little opportunity to correct the problem causing the sudden death. But when we look at other aspect of it is majority of them is cardiac and mostly preventable. So the only way we are going to counter the sudden cardiac death is to look at preventive aspects to prevent the disease. Because once the disease or the pattern of sudden cardiac death sets in within 1 hour, there is very little opportunity to revive the patient, and it's always better to look at the preventive aspects and how we are going to prevent this occurrence of sudden cardiac death. Next. See, if you look at the global disease burden, which is analyzed from 1990 to 2023, 1990 was disability values or the years, which we'll discuss in depth, is there's been a 16-fold difference between different parts of the world. And what is more important is 97.4 million additional dialyses have occurred during this period, and most of these dialyses have occurred because of lifestyle diseases, metabolic diseases, which are eminently preventable. So 79.6% of the cardiovascular dialyses are preventable, which is the important aspect of this discussion. Next. Next question. Can we move on next? Yeah. See, if you look at the factors which have contributed to the dialysis, and 16. The first place. Whereas if we see the diabetes place has gone to the first place. And then you look at the other diseases, chronic kidney disease and strokes. So these four vascular or cardiovascular disease or risk factors have progressed very steeply in the ladder from 1990 to 2016. Next. So this tells us that is very important. Next slide. that we look at these risk factors closely and do whatever we can to prevent the risk factors. Next. Next slide, please. Can somebody move on to the next presentation? Next slide. Yeah, so if you see globally also, the non-communicable diseases from 37.9% in 1990 have become 62 in 2016. And the four major diseases are cardiovascular deaths, cardiovascular diseases, cancers, and the spirit disease and diabetes. Next. So we need to know what is a DALY. This disability adjusted life years, which includes the years of life lost and also the years which are lived with disability when the patient is not productive. So whenever you have a disruption of DALY, it means you're losing productive life to the patient. Next. So if you see the global disease burden of disease study in India, cardiovascular disease is the leading cause of death in 17.8%, and now it is contributing almost 25%. Next. So even the deaths of cardiovascular mortality has shown a steady increase, which is more in the male compared to the female. Next. So if you see 28.1% is dying in cardiovascular disease in 2023. This is the center of the NCD data which is being shared on our websites. And the contribution of cardiovascular disease to DALY is 14.1%, which is quite high. Next. So what is more important is if you take the global deaths 2021 statistics, the most important 10.8 million deaths were attributed to raised blood pressure. So it's very important that we diagnose, we treat appropriately. And then we have the most of the deaths is occurring due to the air pollution. So it's very important to look at this aspect as well. And then the elevated LDL cholesterol, which contributes to 3.8 million deaths. And then we have the tobacco use, 3 million deaths, and fasting glucose, which contributes to 2.3 million deaths. So all of these deaths are preventable or modifiable, which is very important when you plan strategies for the patient as well as the society at large. Next. Next. So among the heart diseases which causes sudden cardiac death, there are 5 categories of diseases we need to know. One is the valve diseases, the heart failures, the cardiomyopathies, the arrhythmia, and the coronary artery disease, which is due to the block in the arteries to the heart. Next. So if you see valvular heart disease, heart has got 4 major valves, the aortic, the mitral, the tricuspid, and pulmonary. And among the 4 diseases, the aortic valve disease is the one which predisposes to sudden cardiac death as a valvular heart disease wise. Next. And then the cardiomyopathies. The cardiomyopathies are the disease which affects the heart muscle. The heart muscles becomes enlarged, becomes rigid or weakened. So it makes it difficult for the heart to pump effectively. This is the number 2 causes of sudden cardiac deaths. Next through. Next. And then the arrhythmic. So when the heart starts beating irregularly, then the heart will not be effectively pump blood to the tissues, which can cause a sudden cardiac death. This is a common cause of sudden cardiac death we see. And this is reversible when you have a defibrillator and you can shock to them and you can bring the patient back to a normal rhythm. This is one gives an opportunity for correction if the defibrillators are available at the site in which the patient develops cardiac arrest. And the last one is the ischemic heart disease. Go to the next slide, which is due to the block in the artery to the heart. So this is very, very important. Whenever the artery to the heart is blocked, that the part of the blood, the heart supplied by the artery goes for necrosis. And this occurs because of the plaque buildup in the arteries to the heart. See, heart has got 3 main coronary arteries. We call it the right, and then the left divides into 2. Next slide. Next slide. So why is it important? Whenever the reduced blood supply to the heart muscle, there's a death of the heart muscles because of the heart function comes down, which contributes to the mortality. Next. Next. So what happens whenever we see, so we have 6 cardinal signs of cardiac disease. So whenever a patient has got any of these 6 signs, they must definitely consult a doctor. A chest pain, which is mostly in the middle of the chest related to the exertion, a dizziness, which is more due to the exertion, a shortness of breath which increases progressively and makes a patient not able to lie down, a palpitation or fast beating of the heart, or sense of fainting or loss of consciousness, and abnormal fatigue. So, whenever the patient has got any of these six cardinal symptoms, he will definitely meet a medical professional and take for advice. Next. See, we see the demography of India when you're looking at young patients. We have 25% of the people less than 14 years, and 15 to 64 years we have 67% of the population, and more than 65 years we have only 6.83%. So the major chunk of the population is the workforce of India, and we see the life expectancy also is now 72 years. Women is 74.13 and men it is 70.95. So anything which alters a life expectancy, the natural thing is mostly by a lifestyle modification which needs to be adapted to. Next. Next slide. So what is young? Whenever we say young, what is young? Anybody who's less than 45 years is young as far as CAD is concerned. And maybe this is the overall definition, but we need to look at anybody who's less than 40. So this can have a severe morbidity because 40 is a workable age. It can have a psychological impact. It can have financial burden for the patient. And with a large population less than 45 years, India faces a huge economic challenge managing the young CAD because you know that any adoption of treatment is also expensive, and if you're going for millions of patients, it's going to take a huge economic burden on the country. Next. Next. So even in hospital statistics, we see that less than 40 years, 6 to 16% of the patients are coming with acute cardiac illness, and one third of all deaths in over the age of 35 are due to cardiac disease. And what is more alarming is that there's an increase of 2% every year as heart attacks under the age of 40 every decade, which is very, very important. 2% over the past decade is a huge increase in the incidence of cardiac diseases. Next. So, if you take the statistics in India, one-fifth of cardiovascular deaths worldwide are in India. And if we see the deaths also, age standardized cardiovascular death rate, against the average of global average of 235, we are in 272, and we are all diseases are striking a decade earlier. And what is more important is early onset, rapid progression, high mortality, and we should also know that the conventional risk factors that we describe, diabetes, hypertension, they fail to explain this increased risk by themselves. So there are other factors like more than genetics and other factors which we need to look into in our population. And there is a variation in different states as well. Next. So what are the challenges in controlling the rising trend? Is unhealthy dietary habits, more of processed food and added sugars, sedentary lifestyle, sitting in front of computers for long hours without activity, a chronic stress and a poor stress coping mechanism, adopting to smoking, drinking as an adoption to counter the stress, smoking and substance abuse, obesity and related metabolic problems, genetic predisposition and family history, a delayed recognition and treatment. That is also very important. Patients should seek medical attention whenever they have symptoms. Environmental exposure to dust pollution. Due to all this, obesity, diabetes, BP, dyslipidemia, genetic factors all add to the risk of the burden of controlling the coronary artery disease. Next. So we have two different types of factors. One which are conventional, one which is non-traditional factors. Next. Next. So these are the non-modifiable. You cannot modify age, you cannot modify family history, you cannot modify the race, you cannot modify the gender. But then there are next slide. There are the big nine modifiable factors, which need next slide please, which we need to look into. So these are the high blood cholesterol, blood pressure, smoking, diabetes, obesity, lack of physical activity, metabolic syndrome, mental stress and depression, the very ignored aspect of cardiovascular disease, and of course sleep. Next. So this is where we stand here. Diabetes is there in 11.4% of the population, and cardiac disease in Indians is 21.4% of diabetics and 11% of non-diabetics. Obesity is 25%, hypertension is 28%. What's more alarming is only 15% are adequately treated. And tobacco, some form of tobacco, on 29%. What is more important is that what is heartening is that the smoking prevalence has come down from 8.1 to 8.1 to 7.1 in 2 years, which is a positive sign because of the promotion of anti-smoking by the government and because of the public awareness at large. Next, next. So what is the crisis? The diabetes progress from 2000, we have progressed to 89 from 32.7 to 89.8, and we are going towards 157. So it's a serious need to control diabetes. Next, hypertension prevalence is about this all southern states. The prevalence is more than 20. There is a serious need to look into reduction and treatment of hypertension. 15% of controllable hypertension is not going to take us anywhere. Next. Lipids too. The low HDL, very common in the south, and the dyslipidemias are present in 25 to 34, up to 35% of the entire population of the country. This also needs to have a serious look at. Next, so obesity, abdominal obesity, 40% of women. The prevalence is 40%, very huge compared to 12% of men, which has got a direct relation to cardiovascular morbidity and mortality. Next. Sleep pattern. This is also a very important aspect. 59% of the people are getting sleep less than 7 hours, and 20% are getting less than 4 hours. So this is a very got a serious implication on the cardiovascular disease, risk factors, and morbidity and mortality as well. Next. So government has taken strong stance because of the statistics of 2016, and they started a national health policy. The four main ticks were stretched against the preventive cardiology: balanced healthy diet, regular exercise, reducing tobacco, alcohol, substance, reduced stress and improved safety in the workplace, and reduced indoor and outdoor air pollution. So these four factors were taken by which we had next slide. Next slide. And then now the NCD of 2023 policy aims to reduce the incident-related morbidity by one-third. So because of all this, the non-communicable disease burden the country-wise is coming down. And even Tamil Nadu government initiative, Makkali Tedi Marthu, it manages risk factors like diabetes, hypertension, and doorsteps. It's a very huge impact program for detection, delivery of drugs to the doorstep, and we ensure the compliance. The impact will be seen in decades ahead because we are going to get more control of risk factors, and the earlier studies have shown very good control of diabetes and hypertension. So what we have moved to look is the preventive cardiology, which is looking to tomorrow's health through today's choices. Next. So simple lifestyle modification. Stop yes for stop smoking and tobacco. I for improve the diet. M for maintaining fitness and healthy weight. Pressure for BP pressure control. L for lower cholesterol, and E for de-stress and ensure sleep. Simple steps for life modification can go. And then you have to follow a proper exercise regime with a warm up, a proper cardiovascular exercise, a strengthening, a functional movements. You have a proper mobility and recovery, and definitely one day of rest. You should know your body, nutrition, and hydration. Next. So that you should know the radar for hidden risk. Know your values. BP less than 120 by 80, the cholesterol values, which is good, which is bad, which is triglyceride. Look at the fasting sugars, the waist circumference. It's very important to know your numbers. Next. In addition to the conventional factors, sometimes you look for novel factors like HSCRP, lipoprotein A, and small dense lipoprotein, which also have got a major role to play in ischemic heart disease and the cardiovascular burden. Next. Sometimes you have to look for non-invasive imaging like an electron beam computer CT scan, detect calcium, which can identify the high-risk individuals. And 65 slice CT may be done to image the plaques, which can cause high-risk plaques, which in even asymptomatic patients, which can lead to cardiac diseases. Simple tests like CAMT or a carotid intima-medial thickness or ankle vehicle index are sometimes used to assess the atherosclerotic burden of the patient. Next. The major challenges are the risk factors of diabetes, hypertension are not detected and treated. dyslipidemias not measured adequately or routinely, dietary discipline not followed, chronic stress, chronic low-grade inflammation like autoimmune diseases are not managed properly, and inherited cardiac disorders and coronary artery abnormalities are not detected, and irregular electric activity is missed, and unless the patient goes to a regular doctor for regular checkup, or if the patient is symptomatic. Next. So there is a role for everybody in countering this menace. You should have an increased awareness to the health education of the individuals to take care of themselves and ensure a lifetime of good health. The patient should be aware that he needs to adopt these practices. There is a role of the caregiver. The doctor needs to detect, he needs to educate and optimally manage the patient's risk factors. There is a role of policy makers as well. You should invest in prevention. Education should start at school level and campaigns to promote health. And then there's a need for preventive clinics. We have a lot of treatment clinics, hospitals, nursing homes. Very few preventive clinics where the patient can walk in and say, yes, I need to prevent my heart disease. You have to look at smoking. Anti-smoking should be promoted. Air pollution should be understood. Yeah, and most importantly, the resources should be allocated for the prevention of heart diseases, which is more useful in the long term in nation building. Next, you always be there is a silent threat. Many heart attacks have no symptoms. Regular checkups are needed. Any heart health affects endurance, and the hidden risks may have cholesterol and decision making may be a challenge in patients with heart disease. Operation challenges, long deployments, irregular sleep, and high salt diet, they all contribute to the increased risk. Next slide. Just as every vessel requires regular maintenance and preparedness to face the storms at sea, the human heart requires preventive care to navigate the pressures of life and duty. A well-maintained heart, like a well-maintained ship, ensures resilience, endurance, and mission readiness. And that is what is the need of the hour. You need to have a promote positive heart health, promote healthy lifestyles, and lower the heart disease burden of the country. Thank you so much for the chance.
Thank you, Dr. Kannan, for the insightful presentation and getting up all these facts so widely prevalent that I think it affects almost all of us. Raj, we will take a set of questions now, and let me just. This is a question from Vikash Sumit. Is palm oil, which is mostly used in packaged food items, responsible for heart diseases in adults and youngsters?
See, the thing is, the oils, I think Dr. Priya Chockalingam will be discussing in detail. So, because she's looking at
Okay.
the preventive anyhow, to take it
Sure.
forward, see, a mixture of oils is what is actually required. We cannot say, for example, we cannot use oil for cooking. Olive oil is mainly used for cooking as a surface oil. Similarly, if you're going to use a coconut oil is a healthy oil if used in particular situations. I think the more I think Dr. Priya can discuss about that topic. Yeah.
Sure. The next question is from Harikesan Harikumar. What are the most common medical causes behind sudden cardiac death in youth? And are they mostly genetic or lifestyle related? This is something you touched upon, but would you want to explain a little further?
See, sudden cardiac death actually, if you see see, because we are not seeing these patients in life, we are seeing the patients only after they are no more. So we have to depend mostly on a post-mortem studies. So they have done post-mortem studies, or initial post-mortem studies have shown that majority had an atherosclerotic plaque. They had damaged heart muscle. They had some valvular disease, some congenital disease but not detected, and some cardiomyopathies. Few had absolutely normal heart. So then they took, okay, this may be due to an arrhythmic cardiac death. So the exact percentage, if you see, 80% had some form of structural heart disease, and 20% have that. So maybe the arrhythmias are contributing without a structural heart disease in 20%. In the genetic component, yes, anything in cardiac, especially if you see the race effects, and if you see the disease pattern in patients and families, genetic factor contributes to many of the cardiac disease. For example, if you see, especially arrhythmias, in long QT syndromes, in congenital heart disease, in cardiovascular disease or atherosclerotic heart disease, the many of them runs in families because the risk factor runs in families. So the genetic component is also there. But in postmortem studies in sudden cardiac death, structural defects have been found in up to 80%.
Right. Another question, doctor, from Dr. Tanveer Hussain. If a person has suffered CCF and is diabetic and hypertensive, what are the general, diets and restrictions that they should strictly, follow and avoid?
Okay. See, the patient is a diabetic and hypertension. So initially concept was to strictly restrict water and salt. But now the recent guidelines have told that you don't have to strictly restrict water and salt. You can have some in some amount of moderation. So up to 3 grams of salt will be okay for them. Number, number two is if you want to take a diet pattern in this group of patients, we say that take small frequent feeds because we don't want to go to heart with already had a congestive heart failure. So give small frequent feeds and the same calories which is required on day-to-day basis. Instead of giving 3 major meals, we can split and give it into 4 major meals. That's one. Second, you should have a strict control of diabetes and hypertension. That is very important because anybody who has got a cardiac failure means he's in the end, he has reached the stage of a complication due to the risk factor. So you should have a strict control of diabetes and hypertension. So that should be the pattern of diet which they take.
I think we have briefly lost Geetha. I
Yeah.
think she's back in. Very, very nicely explained, Professor. So it is an eye opener for me as well. So thank you so much. Yeah, Geetha is back. We are
Dr.
not able
Kannan,
to.
would you have time to take one more question, one final question?
Can you repeat that, Geetha?
Will Dr. Kannan have time to take one last question?
Yeah, no problem. Please.
Okay, great, great. This question is from Pradeep Sudar. What should be healthy heart rate? If it goes below 45 while sleeping or resting, is there anything to worry about? What are the reasons feeling like we're missing heartbeat?
See, even if you do a Holter for healthy individuals, we see that the heart rate dips to like 40 or less than 40 in sleep. And during awake hours, it goes to even 80 or 90 or 100. So these are the healthy there's no need to worry for this. See, missing beats is a different issue altogether. See, missing beats means the heart is beating irregularly. That can be due to atrial or from the ventricle. So if it is from the ventricle, you take an ECG and you find it is from the ventricle. If they are very frequent or if they have got different morphologies, then they are serious. But if it is isolated or the numbers are less in number, then we don't give much importance to that. Second is the patient symptomatic or not? If the patient is symptomatic, then our approach changes. So if the patient is symptomatic and we are able to correlate the symptom to the heartbeat, they have to be treated.
Right. Thank you so much, Dr. Kannan. Do you want to make any closing remarks on general remarks on heart health?
No, it's a great opportunity. It's a great opportunity, the need of the hour. And I think we should be aware of the huge burden that we are facing economically as well as the health-wise, the whole community. And it is time that each of us take the burden on ourselves. It's not just the medical community, the policy makers, the people who transmit information should also spread the awareness that we are really dealing with a very serious situation, and we need to look at the positive cardiac health more aggressively, and the majority of the resources should be allocated for prevention, which will help the cost of which can be allotted to the to the treatment, and the amount which we use for treatment will be tenfold of what we normally would spend on prevention.
Right. Thank you. Thank you so much, Dr. Kannan. I would request the participants to keep the questions coming. Once Dr. Priya's presentation is done, we will be taking the next set of questions. Let me introduce Dr. Priya. Dr. Priya Chockalingam is currently the Clinical Director of Cardiac Wellness Institute and consultant of inherited heart diseases at Kauvery Hospital. Dr. Priya is a specialist in the prevention and reversal of heart diseases through lifestyle modification. With a team of highly dedicated healthcare professionals, the Cardiac Wellness Institute provides comprehensive cardiac rehabilitation and targeted prevention program for individuals from various walks of life. Dr. Priya's work has shown that while diseases such as coronary artery disease, stroke, diabetes, and hypertension are truly global threats, we can prevent and control them if given the right information and guidance. Dr. Priya's international experience, combined with her roots in India, enables her to balance scientific research with personalized care for patients and their caregivers. Her book, Journey to a Heart Health, has empowered individuals with practical information and useful tips for a heart-healthy lifestyle. Over to you, Dr. Priya.
Hello, everybody. Very good morning. Thank you, Geetha, for that wonderful introduction. And huge thanks to the editorial team at The Hindu for this opportunity on, to mark the World Heart Day and to spread awareness about this important, pressing, I would say, need of the hour, which is young sudden cardiac death, and what we can do and how do we prevent this issue, this problem. I think my task has been made very easy after Professor Kannan, Dr. Kannan, who is also my teacher. I've always been inspired by his work. So he has really laid out the importance of this huge healthcare crisis that we are facing. And yes, I'm going to build upon what he has already elaborated and try to provide the listeners with some, I think, practical tips and strategies to help keep ourselves safe. And one thing is we can definitely prevent these problems, these heart diseases. And the other thing is if somebody has already been diagnosed, again, there are a set of tools and strategies that they can follow to rehabilitate and to reverse their heart problems. So can we go into the slides? Next, please. Yeah. So a lot of times the question that I'm faced with, what is cardiac arrest? Is it different from heart attack? So yes, the simple answer is they are different. Okay, so in a single line, I could say that cardiac arrest is an electrical problem, whereas a heart attack is a circulation problem, or in even more layman's terms, a plumbing problem. So an electrical versus a plumbing issue. So when we say a sudden cardiac arrest, there is an electrical standstill. The heart's electrical impulses stop completely and there is no electrical activity on the ECG. You might have seen in movies, sometimes you would see a flat line. So basically that means the heart is not generating any electrical impulses. So this is caused by various underlying mechanisms, the most common of which is a heart attack. Okay, so heart attack, as Dr. Kannan had already elucidated, it is a circulation problem. The blood supply to the heart itself is derailed. There is a block in the blood vessels supplying the heart. As you see in this image here, the heart cells, myocardial cells, are not receiving enough blood supply, and that part of the heart goes into necrosis or damage and death. So it is a problem of circulation or a plumbing problem that may lead to a cardiac arrest or may not lead to a cardiac arrest. But a heart attack is the most common killer disease in the world today. The way you manage a cardiac arrest is very different from way you manage a heart attack. So again, we need trained individuals to be able to address a cardiac arrest. So they follow what is known as a cardiopulmonary resuscitation, a CPR only after they have identified that it is a complete cardiac arrest should a CPR be initiated. Next slide, please. So I'm going to bring in the concept of chronological age. What is chronological age? That is the actual age of any individual. It depends on the date of your birth, and then it progresses upwards every year. Then there is this concept of biological age. Yes, so that is the age at which our body is functioning today. So it does not need to match our chronological age. Ideally, the biological age should be less than the chronological age, meaning even if, let's say, somebody is 70 years old, if their body is healthy and they're fit and they're doing well, their biological age could be 20 or 30. Okay, that's being very ambitious. Let's say it is 50 or 60. But these days we are seeing that the biological age is unfortunately much higher than our actual age. So somebody who is 40 or 50, their body and their heart is also functioning at a very higher age, maybe 70, 80, or they're almost close to end of life. So the third concept is heart age. Okay, at what age is our heart? So that is also a very upcoming and important aspect of age. So all of these, we can address, we can control. Of course, chronological age is not within our control. If we can't reverse that, it's going to go up in one direction. But biological age and heart age, we can control. Let's see how. Next slide, please. So again, as Dr. Kannan had very nicely, described, we have modifiable risk factors that lead to heart attack. Okay, so of these, I think we all are aware that diet, exercise, these are important. We all know that mental stress or psychosocial factors are important. And now we have got awareness about obesity, tobacco use, even alcohol, excessive alcohol is a risk factor. And the last or the first foundation is the blood pressure, the blood sugar, and the cholesterol level. So I think these 9, just like how 9 is a very important number in our culture and tradition, these 9 risk factors, each one of us needs to remember. And we'll talk about probably the diet, exercise, and stress in great detail. And I think in the last 12 years of our experience with our patients, Indian patients in India and abroad, on how we have worked towards their prevention and rehabilitation of heart diseases, we have got a good understanding of what works and what does not work in our population. And we have a lot of evidence and data for this as well. Let's look at the next slide, please. Right. Talking about a balanced, healthy diet. Do you all know that we have to have a particular set of macronutrients and micronutrients that we derive from our diet? Yes, so we cannot do away with these things. These are important and building blocks of the food that we consume. So if you look at macronutrients, carbohydrates, fats or lipids as they're called, and proteins. So these are the 3 main macronutrients. They're the main sources of energy for our body, and usually we consume it in like grams per day. Whereas the micronutrients typically are the vitamins and minerals. They are essential to maintain good health. They are needed in smaller quantities, milligrams or micrograms on a daily basis. So there are multiple vitamins and minerals. You might have heard of vitamin A, vitamin D, vitamin K, and then there's minerals like iron, calcium, magnesium, so on and so forth. But yes, these are the building blocks, and we should ensure that on a daily basis, we get these macro and micronutrients naturally in our diet. Next slide, please. So how do we know if we are eating healthy? So I would just recommend that we follow this eating pyramid. If you see at the bottommost layer of the pyramid, what you see is nothing but freely and readily available fruits and vegetables. They're naturally available sources of vitamins and minerals, and they can be consumed quite liberally. Okay. The next layer of the pyramid you see is healthy grains. So when we talk about carbs, okay, so they basically we get our the carbs come in different forms like rice, wheat, corn, millets. So when we consume them as whole grains, which is less refined, less polished, and in their natural available source, then they are much healthier and they include a lot of micronutrients as well, apart from their energy giving capability. Next in the level, we see our dairy products. So this could be your milk, your yogurt, your cheese, your butter, etc. They can be had, they are a good source of protein. They can be had in specific amounts. And then even above, as you go to the topmost parts of the pyramid, you see that we have the animal based foods, that is meat products, poultry, fish, etc. We could be had in small quantities, preferably the lean meat, okay, not the red meat. And then the topmost part is what we consider the ones which should be had very cautiously. And for instance, oils. Somebody had already asked this question about oils. We will be elaborating on that in a bit. But also the sweet treats, the snacks, etc. Yes, you can't live without them. They're part of life, but keep them to the bare minimum, right? So this is the pyramid that you want to follow. You want to consume at least 5 portions of fruits and vegetables on a daily basis. So that is on average 3 portions of different kinds of vegetables and 2 different types of fruits every day. And then at least 1 to 2 meal a day should be comprised of whole grain products, like your, let's say, whole wheat rotis or brown breads or multigrain, multi-cereal breads, or your red rice, black rice, anything that is not white polished rice. And then more of your millets. Okay, so these should be the building blocks of our diet. Next slide, please. And then Harvard came up with this concept of a healthy eating plate. It is not very complicated. We all pick up a plate to eat a meal. So remember that half the plate should be filled with some form of veggies and fruits. It could be your salads, it could be your raitas, it could be your vegetables as a side dish, or even as a gravy, or whatever you want to make out of your veggies. Have some fruits in it. The remaining half should be divided into 2 portions. So 1/4 would be your whole grain ingredients that we just talked about. We all love our carbs. They're not evil. We should not go be anti-carbs. We should just know that whole grains are the better carbs. And healthy proteins form 1/4. So when we talk about healthy proteins, it could be plant-based proteins, it could be animal-based proteins, and preferably we say plant-based proteins have a better impact and on the overall nutrition. So plant proteins would be anything like our lentils, parpun, and then we also have our vegetables like beans, which could be very healthy in terms of proteins. And now we know that there are soya products which are healthy protein sources, and of course we know that animal sources of proteins are there. So going in for the lean meat is very important. So on the top you see healthy oils and water. Adequate amount of water is very important, and healthy oils, any oil which does not solidify when kept outside. Okay, so that is considered a healthy oil. So for instance, our ghee and butter and even coconut oil would solidify at room temperature. So we say keep that to a minimum. Your healthy oils would be your plant-based seed oils. And as Dr. Kannan also said, olive oil is preferably not used for cooking. It is not meant for high temperatures. It can be used for garnishing your salads, your soups, etc. Our homegrown oils, gingerly oil, let's say our groundnut seed oil. So we have our rice bran oil, and also maybe our sunflower oil, whatever type of oil. These all have a good different proportion of polyunsaturated and monounsaturated fatty acids. So we use what is known as oil rotation. Use 2-3 oils in the house at a particular time. Don't mix them in the same jar or same bottle. Use each one for a different purpose, but keep SOS to a minimum. What is SOS? salt, oil, and sugar. We don't need any added sugar. We have enough of natural sugars in our fruits and vegetables. So if at all you want to add some, added sugar, keep it again to a minimum. Salt is an important part of our diet, but what we add to the cooking is just the visible salt. There's a lot of hidden salt in the foods that we buy off the shelf in the supermarket. So watch out for the hidden salts and try to avoid the trans fats completely. Trans fats are especially present in hydrogenated oils. So one of our listeners had asked about palm oil. So it is quite almost always hydrogenated oil. So that is not healthy. It is a big source of trans fats. So any bakery products, any packaged items, they're all sources of trans fat. So you want to minimize that. If possible, bring it to zero. But if not, as we saw on the top of the pyramid, just try to keep it as low as possible. So do not reuse or reheat cooking oils. That is again another major source of trans fat. If you used an oil once for deep frying, discard it and do not reuse it. Next slide, please.
One question before we move on. You spoke about proteins and clean proteins, and right now, especially among young people between the age of 25 and 50, there's something called a protein fad. Because of growing awareness, a lot of people are working out and going to the gym, and protein supplements are, in news and in conversations all the time. Is there any risk associated with bad or excessive protein supplements?
Wonderful question, Geetha. Yes, before moving on to the exercise part, protein fad has come up probably because we are not getting enough proteins in our diet. Okay, so that is one thing. The second thing is to support people who are training intensively, either as athletic training or muscle building and so on and so forth. But we will, for instance, just focus on us as regular individuals who want to lead a healthy and fit life. We do need about, on average, 1 gram per kilo of body weight of protein every day. So a 60 kilogram individual needs about 60 grams of protein on a daily basis to sustain, muscle strength, to sustain good health and everything. But this is something that we are all falling short of. Okay, so that is something we need to try to get as much as possible through our regular diet. So I would not recommend protein supplements for everybody. It is meant for those, as I said, special categories of people or some with some health issues and they're not able to metabolize or absorb their protein well. So I think as the regular general population, we all should aim to get our requirement of protein through a healthy diet, and that would be definitely achieved by using the healthy eating plate and the eating pyramid concept. Am I clear?
Yes. Thank you, doctor.
Great. And moving on to the next building block of exercise, we all know that sedentary lifestyle is not good for us. We know that we need to exercise on a daily basis, but there are guidelines as to what amount of exercise we all need. So we all need at least 30 minutes of high intent, moderate, or I would say brisk intensity aerobic activity on 5 days of the week. That is equivalent to about 5 into 30, about 150 minutes or 2.5 hours of brisk aerobic activity on a weekly basis. If you look at this, it is not very difficult. Okay, 30 minutes of, maybe if we can cut down some of our browsing or other activities of a sedentary, and or if you can't get it in 30 minutes at a stretch, you can even do 10, 10, 10, 3 times in the day, or you could split it up as 15 minutes in the morning and evening, but it has to be brisk aerobic exercise. Or if you're somebody who's short of time and prefers to do more vigorous aerobic activity, let's say like running or in high intensity cycling or swimming, etc., then it is okay to do about 25 minutes and then spread it out on a few days of the week. Or you can do 1 or 2 days of this low intensity that is brisk activity and 1 or 2 days of vigorous aerobic. You can also combine. But the most important is the last block where it says you have to have moderate to high intensity muscle strengthening exercise on at least 2 days of the week. We will say maximum 3 days, not more than 3 or 4 days of the week. So muscle strengthening activity refers to exercises where we are working against some weight or some resistance. It could be our own body weight that we are using, like for instance, push-ups, pull-ups, and planks, etc., or even your squats and other things. Or it could be using some simple equipment like resistance bands or dumbbells, etc. Right? So, or in the gym, you do have weight machines, right? So you can use them as well. So when we have this clearly laid out, that is aerobic activity on 5 days of the week plus muscle strengthening activity on 2 to 3 days of the week, then we have a solid exercise regime. Next slide, please. So we all know that exercise has several benefits, of which most important is, of course, pertinent to this topic. It strengthens the heart. It prevents cardiovascular diseases. So it is a big boost against chronic lifestyle diseases, including blood pressure, diabetes, cholesterol abnormalities, weight gain. It keeps our bones strong. So that is one important thing. As we age, our bones tend to become weaker, we lose bone density. So exercise is the only way we can keep our strength, muscles and bones strong as we age. And also it is an antidote against depression. So it is an enhancer of emotional well-being. So if you look at the bottom part of the slide, you all know about stress hormones like adrenaline, noradrenaline, cortisol, but you also need to know that there are happy hormones called dopamine, endorphin, oxytocin, serotonin, etc. And these are produced by the brain when we engage in exercise on a regular basis. That's a very important message to everybody down here. Again, we're all now worried about dementia. As people age, they're worried that they might have dementia. So, the best way to prevent dementia is again keeping our physical exercise levels high. Next slide. So, fit principle, we recommend this. Whenever we exercise, we should know, let's say, the frequency, the intensity, the time, and the type of exercise. Okay, so it could be 3 or 4 days in the week, as we are talking about, based on what type of exercise. We should know how intense the exercise is. How hard are we exercising in each session? What is the duration? What is the time? 30 minutes, let's say half an hour, 1 hour. So you should know how long your session is and what type of exercise. Is it aerobic? Is it muscle strengthening? Is it flexibility exercise or balance exercise? There are various types of exercises. So once you follow the FIT principle and you have a good comprehensive exercise plan in place, again, I'm sure that will ensure against succumbing to any heart problems. Next slide, please. So it's important to enjoy your exercise. And if you don't enjoy the exercise that has been prescribed to do, you've been asked to do, then try to identify your active hobbies. So active hobbies, again, are something where you are physically active and this is something you enjoy. So that is very personalized. I mean, these are some examples of people going for walks or swimming or cycling. Now, there are so many different activities that have come up it's very personalized. You might like something, your family members might like something, but try to identify something that you are passionate about, and in that way you would ensure adherence. You will not fall off the charts within a few weeks or months. Next slide, please. And move at work. Yes, we all spend about 10 to 12 hours, if not more, at work these days on a daily basis. So try to take your meetings, standing, or walk up and down your stairs around your office, go chat with your colleagues if possible. There are some workstation exercises that each one of us can follow. If we have to sit in our office chairs for a long period of time, as you see in this chart here, just simple movements of different joints and stretches and bends, etc., can help us to relieve the stress and to actually keep the circulation going and prevent a lot of health problems. Next slide. So the most important topic of stress and stressors. Yes, as Dr. Kannan said, it is a hugely neglected part of the risk factors of heart disease. So I would like to separate it as stressors, the pressures coming from outside. Okay, so they're going to be there all the time. Stress is nothing but our own response to these stresses. So if we manage our stress response better, that is through stress management techniques, next slide please, we should be able to lead a very healthy and emotionally balanced life. So what type of stress management works for you? Again, as I said, with exercise, this is very personalized. Some people might say deep breathing is a good stress reliever for them. Some of them just walking, just going for a walk outside in the nature can be a stress buster. For some, it is yoga, meditation, right? So depends what you love doing and what brings your stress levels down. But the key is to keep doing them regularly, whether you're stressed or not, to spend, let's say, half an hour at least on a daily basis on what gives you a good calming effect. So these are stress management techniques. And again, it's very individualized. If you can think about what works best for you to calm you down and which is also an active hobby, then you have a double whammy, and I'm sure you're going to be physically and emotionally safe. Next slide, please. And I don't have to re-stress this, but tobacco in any form, not just cigarettes, but even the e-cigarettes, the vaping, etc., and even passive smoking. Okay, and in addition to smoking, we also have chewing of pan and snuff, etc. So tobacco in any form has to be completely avoided. No two doubts about that. Alcohol in occasional use or in moderation is not a big threat, but alcoholism or being addicted to alcohol is a major threat for the heart health. And then, yes, we all need to track our weight, our body weight. That's body mass index. We need to know our waist circumference. We need to prioritize sleep. I think that is a very neglected part of overall health these days. At least 7 to 8 hours of good quality sleep on a daily basis is extremely important. So, a good sleep hygiene, a good bedtime routine is something we should all aim for. And I think, in parallel to that, gadget free time is extremely important. So, time away from your gadgets on a daily basis, like just being mindful of yourself, let's say of your family, of your surroundings, going out into the nature or a park. I mean, somewhere where you don't just carry your gadgets with you all the time. You're not completely wired all the time. I think that is very important, and it is also linked to a good sleep quality. Next slide, please. And the three silent killers. I think Dr. Kannan had already mentioned about this, but hypertension, diabetes, and lipid abnormalities will not come to the surface, will not be identified unless you submit yourself, you go for a regular health check. So after the age of 40, everybody, independent of your gender or your work profile or your family history, you do have to get a regular health check, basic, simple health check looking at these parameters on a yearly basis. The current guideline is from the age of 20. I mean, that's young, right? We all have our children who are in their 20s. From the age of 20, they say that every 5 years, you should start getting a regular health check. And then after the age of 40, every year. Because at the age of 20, if we detect any of these abnormalities, either in behavioral risk factors or family health risk, etc., that's the best age to start making changes and to reverse their already high risk for heart disease. Next slide, please. So we follow what is known as the simple SMART goal setting method. So when we talk to our clients, their big goal might be they want to reverse their coronary artery disease. They want to reverse their heart failure. They want to get their blood pressure under control, their abnormal sugars under control. But it cannot be done overnight. It has to be done through specific, measurable, attainable, relevant, and time-bound goals. Okay, so small baby steps on a daily basis. I think that is the key ingredient here to make significant and important lifestyle changes, because behavioral change is going to take time, but each change that you make will help you reinforce that, oh, yes, I can do this. And then you will start building upon it. And within a matter of a few months, you would have already started making some significant changes. So remember the SMART goal. Don't try to go from 0 to 1 overnight. Remember that baby steps are very important. Next slide, please. And to sum it up, you should know your risk of heart disease and follow a prevention program. So we have, as I said, a very wonderful opportunity to provide prevention and rehab programs for our patients. And we have seen immense success. So people are following this, they are benefiting, and we have published in a lot of national and international journals. If you have missed the boat, if you already have a cardiac problem, no worries. You can follow a cardiac rehab program and reverse your disease. You can minimize your chance of complications. People are surprised. Can coronary artery disease, can these plaques be reversed? Yes, there's a lot of evidence that this can be done. You need to follow medications, you need to follow your doctor's advice, and on top of that, make those targeted lifestyle changes that could help you prevent and reverse disease. So once again, thank you for the patient listening, and it has been a wonderful opportunity. I'll be glad to take questions, Geetha.
Sure, doctor. Thank you. Thank you so much for the very lucid and very insightful presentation. First question that I had was the last point that you mentioned about reversal. Is there any age limit up to which you can, reverse your cardiac conditions?
No, there is no age limit. You might be in your 90s, you might be in your hundreds, yes, you might be in your 20s. You could start working today to reverse your disease. The important thing is the earlier the better. Once somebody has had, let's say, diabetes or hypertension or cholesterol problems or heart problems for a significant period of time, maybe 10 years, maybe they lived with it for 20 years, when the duration is longer, when you start your reversal, then the reversal is going to be so much more difficult. And especially if the plaques, that is the blocks inside the arteries, have already calcified, if they've already become hardened, then again, their reversal is going to be difficult. But even then, even those individuals, they will start developing new coronary arteries. We call this as natural collaterals when they start making lifestyle changes. So there is no age limit.
Right. Thank you. So I guess testing is key. And related to this, there's a question from Saran Raj, who asks, is there a test available to know the biological or heart age to be aware of our body health condition?
Great question. Yes, there are some it is not one particular test. It is a group of evaluations that we do. So a simple thing like whether you smoke or not, what is your lipid levels, and whether you have high BP or not, together with a few, questions regarding your family history. So there are some online, calculators, but again, this is population specific. The calculators have been developed for Western populations, but these might not reflect exactly the risk in our population. So I would say speak to your physician, speak to your cardiologist, speak to your, whoever you know as your healthcare professional, and they would be able to guide you on what are some simple steps or simple tests that you could take to identify your heart age better. But it is a combination of mindset also, because again, a lot of these tests do not fit into the emotional aspect. So we, for instance, have developed our own questionnaire where we are able to assess the individual's emotional well-being, their quality of life, and then also extrapolate that onto their physical parameters or their biochemical parameters and give our patients a clear idea of where they stand in terms of heart age and biological age.
Right. Thank you, doctor. You touched upon alcohol consumption. There is this question from Dr. E. Srimathi Naidu, which I'm slightly rephrasing. Is regular alcohol intake, even in small amounts, coupled with high BP and sugar levels, lead to any cardiac conditions?
Right. So the question is, on a daily basis. So see, again, small quantities on an occasional basis is not a problem. So when you ask the question as you already have high BP or, high blood sugar, you're already on some medications, let's say to treat your hypertension or your diabetes. So alcohol is going to interfere with how these medicines act. Okay, so they might worsen the side effects of your medications. This holds good also for cardiac medications, or they might reduce the impact of these drugs on our system. So in general, if somebody is on medications, yes, they should avoid or keep alcohol to a very minimum. If you're not on medications, then again, moderate occasional use of alcohol is not a problem, but daily use or something like an addiction is something that you need to completely get a solution to.
Right. The next question is from Minor Strategy. How much everyday walking is good for heart health? CT angiogram treadmill test, which is good to know the current blockage level in advance as the routine checkup.
So the answer to how much everyday walking, yes, as I said, at least 30 minutes of brisk walking on 5 days of the week. That is a basic bare minimum. And then we need to build up upon that. And I said the key word is brisk walking. And your question as to CT angiogram, CT angio is quite an advanced test. So a treadmill test is quite a good test, but again, it has its limitations. A routine ECG and echocardiogram, these are the things which, in addition to our BP, blood sugar levels, cholesterol levels, etc., gives us a clear understanding. And as I said, behavioral risk factors are quite often overlooked. So get all of these, evaluated, and to understand it better, if and only if necessary, then we go in for a CT angiogram. A treadmill test, again, is more like a fitness test. It can be used to understand how your heart responds to a physical stimuli like exercise. Okay, so it gives us, in fact, we use it very often in our cardiac rehab prescription as to what amount of exercise somebody has to be prescribed, right? And that depends on how much exercise their heart and lungs can take. But again, whether it can be a diagnostic test by itself, there are some limitations. And then if we find something abnormal in a treadmill test, we do go in for an angiogram. It could be a CT angiogram or it could be a conventional angiogram done in a cath lab. But either or both of these should be discussed with your treating physician and decided on which one to go for.
So a treadmill test is good to begin with.
It can be done. It should be done if you think that you might be at risk or you want to understand how your heart responds. So again, don't go in for a treadmill test just because it is part of let's say a package, right? So have a discussion with your healthcare provider and try to understand what is your need for a TMT and then go about it. Yeah. But before all of these tests, before going in for all of these tests, try to make the lifestyle changes that are important.
Right. There were a couple of questions, Doctor, on badminton as replacement for exercise. What would you say about that?
Your voice is breaking. Could you put up that question, Geetha?
Yeah. Badminton as replacement for exercise. There were actually a couple of questions related to that.
Okay.
Let me.
Okay. So sports, any sports, okay, any outdoor activities, of course, badminton can also be an indoor sport, but any sport that you play also has a social component to it. So it has an added advantage, but I would not say that it suffices to be the only exercise. A sport activity is good to have. You would probably play it on, a few days of the week, but in addition to that, you should have muscle strengthening, core strengthening activities, and some form of stress management exercises or activities like yoga, meditation, stretching. So yes, even if you're playing badminton, there's a rule, there's a rhythm to it, like warm up, play your sport, and then cool down, whatever sport it may be. That's important to do. But in order to be able to play a sport better, you should have good muscle strength. So remember that it all works as better as a package, and just don't stick to one form of exercise.
Right. Dr. Mr. Karthikeyan P, I think he needs a clarification on bread. So he says that, ma'am, you said that we can use brown bread, but brown bread is also a bakery item which you said that we should not use. Can you clarify on that?
Great question. So when we talk about bakery items, we typically mean the pastries, the cakes. Okay, so if you're somebody who uses bread in your diet on a regular basis, the healthier form of bread instead of the white breads is your multigrains or your brown breads. And if you are mixing it up with some good salads or some garnishing it with healthy stuff, then why not? But the problem is that we consume a lot of other things like pastries. We just don't go to the bakery and buy a loaf of bread and come back. We come back with some pastries, cakes, and other things which are, not the healthiest. So those are laden with a lot of trans fat. But bread from a good source, I would definitely go in for the whole wheat if possible.
Right. This is a question from Syed Mustafa, a little tangent from your discussion, but see if you want to comment on it. So he says, adenovirus vector-based COVID vaccines have been reported to cause fatal blood clotting via ITD. Do you agree with any link to the current topic?
Interesting and important question. Yes, I was curious. Nobody had asked this question earlier. The bigger problem or the bigger threat is the coronavirus itself, right? So we know that coronavirus does not just affect the lungs; it has very important and significant impact on the heart muscle and the blood vessels supplying the heart. So anybody who has had a COVID infection in the past, which could be many of us, we need to definitely ensure we get an ECG and echo to understand where we stand. So I don't think a lot of the doctors or physicians are even stressing this point. So that is point number one. The second point, as to the vaccine related events, I would say they're very minimum. They're not a risk at all. So if you have received the vaccines, great. If you have not, or if you've been in fear of the vaccines, please take the vaccines, because the risk after a vaccination is negligible as compared to the risk because of the viral infection itself.
Right. Thank you, doctor. Do you have time for one last question, couple of questions? Just there.
Sure. I have all the time, no problem.
Okay, great. There's a question from Mr. Balaji Natarajan who's asking, are there any correlations with liver disease or liver regeneration leading to cardiovascular disease or IBD?
Yes, I would say liver diseases, especially now we're seeing a lot of non-alcoholic fatty liver disease, NAFLD as it is called, and they're a component of the metabolic syndrome that we're seeing. So metabolic syndrome has to do with obesity, that is diabetes or sugar metabolism abnormalities, as well as lipid abnormalities. And now we are seeing the liver disease as a component of this metabolic spectrum. So heart disease are much higher, heart attacks are much higher in people who have a metabolic syndrome. So we also need to look out for our liver health. So having a liver enzymes included in our yearly blood check is very important. Similarly, kidney disease. This question might come up, but yes, kidney diseases and heart diseases are it's like a comorbidity that you are seeing quite often these days. So chronic kidney disease, or people who have requirement for dialysis, etc., because the risk factors are the same. Diabetes and hypertension are lethal to both the kidneys and to the heart, to the brain, and also to the liver and other organs. So we need to keep our basic, the foundation healthy and strong to keep all our organs healthy.
Right. Thank you, doctor. Just a note again to the participants, kindly avoid any personal questions on diagnosis. I'm sure Dr. Priya would be happy to take it offline. We have one question from Mr. Ramesh Rajendran, who wants to know what signs can indicate sleep problems need further medical attention with respect to sleep.
Sorry, could you repeat that? Your voice. What sign indicate my sleep?
Yeah.
Okay, good question. So sleep medicine is again an evolving and quite an important branch of medicine itself. So snoring itself is something that needs particular attention. So, some mild snoring, which is not a major, concern, is fine, because, but again, somebody who's fit and who's exercising well and who has their body weight under control and good muscle tone should not have snoring. So that is one thing. But snoring, when it is associated with you suddenly wake up and you're gasping for breath, or you're literally like short of breath, or somebody who's next to you has felt that you snore and then your breathing actually stops for a few seconds and then you resume breathing. So these kind of patterns indicate that you need to go in for some sleep studies. Okay, so sleep apnea syndrome is what we are worried about. So sleep apnea refers to this pattern of actually snoring, and then you stop breathing, and then you start rebreathing or breathing again. So sleep apnea could be detected by sleep studies, and again, this is a surrogate marker of cardiovascular diseases. So somebody with sleep apnea has a high chance of having heart muscle diseases and even arrhythmias. So we need to take it up further. But if there are no such indications or signs, and if you just have some snoring, just modifying your lifestyle itself might help to control that issue of snoring.
Right. Um, yeah, we have a question again on liver. So many people have fatty liver. How to avoid the same or reduce them? From
The
Charumati
same
Devi Babu.
building blocks of lifestyle. So a high fiber diet is very important. So that is why I keep re-stressing the fact that you need to have a high fiber diet to reverse your fatty liver, to reverse your cholesterol abnormalities, to even address problems like poor bowel habits, etc. So I think a very rich, fiber-rich diet, in addition to all the other macronutrients and micronutrients, will help even avoid certain cancers like colon cancer. So I think getting the help of a nutritionist, a team of, I have always stressed that one physician or one healthcare professional cannot address all the risk factors. So it is a multifactorial disease, heart disease, etc. So we need to have different experts addressing it, and it needs to be personalized. So don't look in the Google, or don't just go into the internet and get all the information, because that can give you some idea, but personalized plans and advice has to be given by experts who are dealing with people with similar issues, and like in a local population.
Good you mentioned, because now there's also Chat GPT and other AI where we type in our questions, and yeah.
Absolutely.
One question from Raja Ramanan. Do you recommend monitoring salt or sugar intake on a daily basis to control the intake? If yes, how much do you recommend?
Right. When it comes to salt intake, as Dr. Kannan also said, if you are somebody with cardiac complications, yes, salt and water we need to be on the watch out for. But otherwise, on a daily basis, if you not have any other health problems, using salt up to about 3 to 5 grams is what we say. But 3 grams is better to try to stick to on a daily basis. Again, when we are cooking, we don't actually practically measure the amount of salt that we're using, but not having added salt, like not keeping table salt and adding to our food, or not keeping pickles and papads on the dinner plate on a regular basis. So these are the things which come with the hidden salt: pickles, papads, packaged foods. So keep that to a minimum. And your other question was sugar. Was it on sugar or just salt?
Yeah, sugar also.
We do not need any added sugar, period. So if you're adding any sugar to your tea, coffee, or whatever, keep it to a minimum. And if you can, try to avoid added sugar. When I say added sugar, I also mean honey, I also mean brown sugar, I also mean all forms of added sugar. So one is not better than the other. Even your sugar substitutes, which diabetic people tend to use, you need to remember to keep them cut down, keep them to a minimum if possible, because they do also have side effects.
Right. Thank you, Doctor. Doctor, I think we'll end with this one last question. When a person has, this question is from Subhashini, when a person has cardiac arrest, what is the time in saving golden hour? What steps do we take during the golden hour?
Okay, two things. Great question to close off the session. So, cardiac arrest, there is no golden hour. Cardiac arrest means the heart has come to a standstill, and immediately somebody who knows CPR has to be on the spot to address the situation. They need to either give CPR, or if they have a defibrillator, let's say you also might have seen in the public places, red color equipment, it's called a defibrillator. Somebody trained to use a defibrillator has to put it, but that is only after they have identified that the person is in a cardiac arrest. The golden hour applies to somebody who is having a heart attack. Okay, so they have, let's say somebody is complaining of chest pain, they have sweating, they're like either near collapsing, so you should immediately call the ambulance. So there is again Do not try CPR. Do not try your own, local things like whatever local remedies will not work. Some people have heard a lot of rumors, I think, are circulating. Try coughing, try other things, and self remedial measures. Do not try any of this. If you're alone, get to an ambulance, or to get the ambulance come to you, or alert somebody who can call the ambulance to come to you at the earliest, and go to a center or a hospital where there is a tertiary level hospital, if at all possible. That is where the time to the cath lab is the lowest. So the door to cath lab, as we say, from your house to the cath lab, if that time is less than 1 to 2 hours, the chance of good treatment and complete recovery is very high. If there is time loss of 3 to 4 hours or more than 6 hours, then the heart muscle is already losing important blood supply, and the long-term impacts could be much severe. So the golden hour is when somebody suspected to have a heart attack, at the earliest try to get them to a tertiary level hospital. If you're suspecting somebody has a cardiac arrest, confirm that first. If you're not the right person, if there's somebody, try to confirm it, or just call for the ambulance, wait for the experts to come, because only if it is a cardiac arrest, you will initiate cardiopulmonary resuscitation or provide defibrillation if an equipment is available. I hope I'm clear with the difference.
Yes. Thank you, doctor, for the great explanation and the presentation as well. I personally learned a lot, and I'm sure our participants did too. So thank you for joining and taking the time on a Sunday.
Thank you so much
to all our participants. Yeah.
Thank you. I really loved participating, engaging with all of you. I hope people will take this as an eye opener and start changing their lifestyle from today. There is no better time than today. So all the very best to all of you. Thank you.
Thank you, doctor.